Do you get pain under the kneecap, especially when you're going downstairs, squatting, or getting up from a chair? I'm Dr. Dave Candy, and in this video, I'm going to explain what causes pain under the kneecap and some simple tips to relieve kneecap pain so that you can move more comfortably. Now, first of all, what causes pain under the kneecap? Well, that really depends on what you mean by under the kneecap. If you mean below the kneecap, as in closer to the foot, that's usually due to a tendon problem. The most common cause is the patellar tendon that connects your kneecap to your lower leg bone, the tibia. But you've also got some tendons, the pes anserine tendons, on the inside of your knee below the kneecap, and your IT band on the outside of the knee below the kneecap. So accurately describing the location of your symptoms is going to lead to a better diagnosis. Now, if you mean you have pain under the kneecap, as in behind the kneecap, that's due to something known as patellofemoral pain. And the patella is your kneecap, and the femur is your thigh bone. So patellofemoral pain really just means your kneecap rubbing on your thigh bone. That can happen due to kneecap arthritis, or a lesser form of that known as chondromalacia patella. It can also happen just because your kneecap isn't tracking properly in the groove on your femur. Now we'll go into solutions for each of those, but fortunately, many of the same tips are going to help all of those different causes of kneecap pain. Now, one of the most common things that bothers people who have pain under their kneecap, whether that be below the kneecap or whether that's pain behind the kneecap, one of the most common things that bothers people is going downstairs. So here's some tips to help you go downstairs without kneecap pain. When you're going downstairs, you have to be able to bend your knee and bend your ankle while keeping your hip fairly straight. That makes going downstairs substantially harder than other activities like squatting or getting up from a chair, because when you're squatting, you have three joints to move from: your ankle, your knee, and your hip. When you're stepping forwards down a stair, you lose a lot of the strength from your hip. And your butt muscles, your glute muscles, are one of the strongest muscles in your body. So that puts substantially more force on your thigh muscles. Now, when your thigh muscles are contracting as you're going downstairs, that creates compression behind the kneecap, so it can cause patellofemoral pain. It also creates tension on the patellar tendon, and so it can cause patellar tendon pain. So in order to be able to go downstairs more comfortably, you have to be able to bend at your knee and bend at your ankle. Now, so that you don't create so much tension on your quad muscle when you're going downstairs, you have to think about using other muscles. Most people don't think about this, but your calf muscles actually help you with going downstairs. Most people think of the calf muscles as pointing your toes like that, or raising up on your toes when you're standing. But your calf muscles can also work eccentrically, meaning they're lengthening at the same time they're contracting to help you lower downstairs. And so we're going to first work on an exercise to improve your ankle dorsiflexion mobility, and then next we're going to work on something to improve the eccentric strength of your calf muscles, and specifically the deeper calf muscle known as your soleus, which is more active when your knee is bent. Now, first, to improve your ankle dorsiflexion, or the ability to bend forwards at your ankle, we're going to use a stretch band. You want to use a band that's fairly thick, but having a loop band like this makes it pretty convenient that you can place it around one ankle and then around the other leg. So the leg we're going to work on first is this one. So you put that leg in front. You want the band to hit right at the bend of your ankle, and then you secure it around this other ankle. Now you just go into a little bit of a lunge there, keeping your heel flat on the floor. Now this band pulls the talus, a bone in your ankle, backwards, and it allows you to get a little bit farther into ankle dorsiflexion. At the same time, it also helps to hold your heel down onto the floor. So you just go into a little partial lunge, just go as far as you can comfortably, and rock back and forth in that range of motion. And you can switch sides, make sure it's right at the crease of your ankle, and lunge forward like that. Again, keeping your heel of the front foot flat on the floor and just lunging as deeply as you can. Now, after we've improved mobility of your ankle, the next thing is to work on strengthening your soleus eccentrically. So to do that, you're going to dome the arches of your feet. Make sure you've got a good arch in each foot and start out on 2 legs here. It helps to have something on either side to hold on to. And then you're going to push your knees out forwards over your toes while keeping your hips in relative extension. So your glutes are going to be squeezing and activated to keep your hips tight. Your abdominals are also going to be tight during this. So you're just pushing the knees out forwards over the toes. This is kind of like doing a bridge on your back, but the standing version. So you're just pushing the knees out over the toes, keeping your glutes activated and extended at the hip. This is helpful because, again, you have to keep your hip in a relative amount of extension as you're stepping forwards off of a stair. So hold on, push the knees forward, firing the glutes, and just rocking your knees as far forwards over your toes as you can without your heels lifting up off the floor. Now, after you've done that, the next step is to move to one leg and thinking about sliding forwards with this foot as far as you can. That, see it on the other side, put the weight on the foot and slide the other leg out forwards like that. Now it's time to move up onto a stair. Now, after you've improved the mobility in your ankle and you've improved the eccentric strength in your soleus, it should be easier to step down a stair. If you're still having difficulty, there are a few compensations you can use. For example, if you lean forward slightly, you can get your glutes into it a little bit to help out. Additionally, if you're still having trouble, if you hang the ball of your foot over the edge of the step, you can kind of roll over it and you don't need as much ankle mobility. Now, that's a short-term solution, but it often works immediately and works rather well. Now, what about squatting? For example, squatting down to pick something up off the floor. That's another activity that often bothers people with kneecap pain. And there are 2 planes of motion you really need to think about with this. There's the forward to backward plane, and then there's also the side to side and rotational planes. And so with the forward to backwards plane, unlike going down a stair, you can now use your glute muscles, which are substantially stronger. So instead of pushing your knees out forwards, you now have the option to sink your hips back. So as you're squatting, you want to think about pushing your hips back and leaning your trunk forwards. If you were to keep your trunk perfectly upright and sit back, you'd fall backwards. So you have to lean forwards a little bit to counterbalance your center of gravity and keep it over your feet. So pushing your hips back, just go as far back as you can comfortably when you're starting out, and then push the hips forward. So it's more of a hinging at the hips, hips back, hips forward, and your glutes are doing the bulk of the effort so that your quad muscles don't have to work so hard and don't create compression behind your kneecap or tension on the patellar tendon. Now, from the front angle, you also need to control this motion because remember, your kneecap has to track up and down in a groove on your thigh bone. And if you're going too far in like that, the kneecaps track laterally over the outside of the groove. Additionally, going in like this can put some tension on those pes anserine tendons on the inside of the knee. So you want to make sure you have your feet at a width that's about shoulder width apart, maybe slightly wider, and your feet can either be facing straight ahead or slightly turned out, depending on what feels more natural for you. But wherever your feet are located, you want to make sure that your knees are then turned out over top of your feet. And that'll often create an arch in the bottom of your foot. You want to maintain that arch so that you have a solid base to push off of. So set your feet, turn your knees out. Now remember, you're dropping your hips back while still pushing your knees outwards like that. Then push your hips back forwards and come back up. So you're driving your knees out and then keeping the knees turned out as you come back up. So you're doing that the entire time as you're doing hips back, hips forwards, hips back, hips forwards, hips back, hips forwards. So that's squatting. Now what about getting up from a chair? Getting up from a chair is a little bit different than going downstairs or squatting, because rather than starting at the top and lowering down to where you feel comfortable, you're now starting from a dead stop at the hardest part of the motion. Additionally, this is a concentric motion, meaning you're shortening the muscles and raising up, as opposed to with the other ones, you're lowering down. So there are a few differences here, but largely the mechanics are fairly similar to a squat. So you want to have your feet set underneath of you, feet flat on the floor, knees out over toes. So you don't want to buckle inwards. That's one of the largest, most common problems that I see in people when standing up from the chair, is letting their knees buckle inwards. So keep your knees turned out over your toes, lean your trunk forwards, and you should actually start to get your weight out over your feet before you ever start to push with your legs. Additionally, you still want to use your glute muscles. So you're going to lean your weight out over your toes, and then rather than thinking about straightening your knees, you're still going to think about pushing your hips forward. So get your weight out over your feet. This is all physics, all leverage like a teeter-totter. There's virtually no muscle effort involved in this. And then once you get up over your feet, then you just push your hips back underneath of you. So again, it's more glute than quad, and that decreases the amount of compression behind your kneecap. It also decreases the tension on the patellar tendon. So again, rock forward till your weight's over your feet, then push your hips back underneath of you. Now, the taller you are or the lower the chair, the harder that task becomes. But I've got another video that tells you all about how to get up from a low couch, a low chair, or a low toilet. And you can check that out over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.